Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Dr. Muhammad Usman, and in this video we will talk about Lambert Eaton syndrome. So basically it is an adult onset autoimmune disorder, and 60 to 75% of the patients are males. Mean age of presentation is about 58 years. So let's see what is the pathophysiology of this autoimmune disorder. Basically, in Lambert Eaton syndrome, autoantibodies are formed against these voltage gated calcium channels which are present on the axon terminal. So as a result, there is less or no calcium influx, and when calcium is not available to fuse with the synaptic vesicles, then as a result release of neurotransmitter acetylcholine from the axon terminal becomes less and less, leading to muscular weakness. Now, repetitive stimulation of the motor nerve facilitates the accumulation of calcium in the axon terminal and increases acetylcholine release, leading to an increase in muscle strength. This is in contrast to the myasthenia gravis, in which the symptoms worsen on doing work. Okay? And you can also see that in myasthenia gravis, the antibodies are directed against the acetylcholine receptors. Now, 40% of the patients with Lambert Eaton syndrome, they also have a cancer, especially small cell cancer of the lung. And one theory is that antibodies which are produced by the body to attack the cancer cells may also attack the calcium channels, leading to Lambert Eaton syndrome. And a syndrome similar to Lambert Eaton syndrome can occur after the use of aminoglycoside antibiotics, which also impair calcium channel function. Now, the various signs and symptoms of this syndrome are: number one is the muscular weakness, and typically this weakness improves on activity. Then proximal muscles of the lower extremities are primarily affected. Okay. In this figure, upper limb is shown, but primarily there is lower extremity muscles and proximal muscles of lower extremity, they are more affected, producing a waddling gait and difficulty raising the arms. Waddling means a duck like gait. The person also has difficulty in standing from a sitting posture. Then cranial nerve involvement is also seen in about 70% of the patients, and ocular symptoms like ptosis and diplopia are the most common. In some patients, dysphagia and dysarthria are also seen. Then autonomic dysfunction is also reported in about 80 to 96% of the patients, and due to this, dry mouth is the most common symptom. Other symptoms include constipation, orthostatic dysfunction, altered perspiration, and erectile dysfunction in males. Now, respiratory failure is infrequent in Lambert Eaton syndrome. Now, following tools help in the diagnosis: detailed history and clinical examination, then detection of antibodies against voltage gated calcium channels, and we can detect the autoantibodies in 80 to 95% of the cases. Then if extensive search is done, then small cell carcinoma of the lung may also be found in most of the patients. And due to strong affiliation with malignancy, the diagnosis of Lambert Eaton syndrome should prompt an immediate and extensive search for underlying malignancy. Now, the differential diagnosis of Lambert Eaton syndrome is mostly from the myasthenia gravis. And in Lambert Eaton, we know that the antibodies are formed against these voltage gated calcium channels which are present on the axon terminal, while in case of myasthenia, the autoantibodies are formed against the acetylcholine receptors which are present on the muscle. and in Lambert Eaton usually it starts from extremities and moves up, while in myasthenia it starts usually at eyes and it then moves down. Then in Lambert we know that the weakness improves upon activity, while in myasthenia weakness worsens upon activity. Usually Lambert Eaton is associated with small cell carcinoma of the lung, while myasthenia may be associated with thymoma. Then treatment of Lambert Eaton is usually aminopyridines, while myasthenia symptoms become better by using acetylcholine esterase inhibitors like neostigmine and physostigmine. Now let us see what is the treatment. Aminopyridines are available, and these aminopyridines facilitate the release of acetylcholine at the neuromuscular junction. Basically these drugs block presynaptic potassium channels and promote activation of voltage gated calcium channels. Then sometimes the acetylcholine esterase inhibitors are also used, but usually they have little effect. Because it is associated usually with underlying malignancy, so it must be treated. If any underlying malignancy is detected, it must be treated. Thank you for watching today's video. Please subscribe to this channel. Stay blessed and Allah Hafiz.